My name is Michelle Morgan, and my presentation is on sexual coercion, what college students need to know. Sexual coercion is non-consensual sexual behavior that occurs as a result of arguing, pleading, and cajoling. It can also include force. Coercive sex always includes elements of power, which can be implied or absolute based on the victim's perception, and victimization, which is when someone is deprived the ability to choose and is forced to endure, observe, or comply with sexual acts. Sexual coercion involves many non-consensual tactics such as verbal threats like insult and blackmail that are used to instill fear or anxiety to control a victim's behavior, implied threats which may not be verbalized but are understood by the victim based on their previous experiences. Physical force can also be used, but it's important to note that some victims never suffer any visible injuries, and the use of substances like drugs and alcohol, which can lower inhibitions and impair a victim's ability to make sound decisions or to help themselves physically. Some examples of sexually coercive behavior are when they threaten or use physical force to make you afraid to say no. They give insecure compliments or use drugs and alcohol to encourage compliance. They may badger, yell, and continue to pressure you even after you say no. They may react with sadness, anger, and resentment when they are denied sexual contact. And they may justify their behavior by saying things like, I need it, I'm a guy. Sex is how you can prove your love for me. And if I don't get it from you, I'll get it from someone else. Sexual coercion is quite prevalent in the United States, and according to my research, 13% of women and 6% of men have experienced sexual coercion at some point in their life. This is defined by unwanted sexual intercourse by using non-physical means of coercion. 27.2% of women and 11.7% of men have experienced unwanted sexual contact in their lifetime, which was defined as inappropriate touching and verbal harassment. Also, 4.8% of men reported they were made to penetrate an intimate partner or acquaintance at some point in their lives. Research has shown that sexual coercion is experienced by all ages, regardless of gender. However, the rates are highest among 18 to 24-year-old females. So, can sexual coercion lead to sexual assault? Yes, it can. The clearest case of sexual coercion is where physical violence or threats of it are used. Any form of coercion that diminishes one's capacity to freely consent to sexual intercourse can be grounds for a charge of sexual assault. To put that into context, in the United States, nearly 1 in 5 women and 1 in 71 men report they have been sexually assaulted at some point in their lives. 51.1% of female victims report being sexually assaulted by an intimate partner and 40.8% by an acquaintance. 52.4% of male victims report being sexually assaulted by an acquaintance and 15.1% by a stranger. Research has shown that several negative consequences related to being a victim of sexual coercion exist. These could include increased likelihood of negative interactions in current and future relationships. Jealousy tends to increase after an event. This could possibly be due to lower self-esteem or self-worth. Serious dating tends to decrease after a coercive event, and there could be an increased frequency of sex and increased number of sex partners after a coercive event. And it's important to note that these two can lead to an increased risk of being victimized again. Research shows that victims report themselves suffering from post-traumatic stress disorder, depression, substance use disorders, and rate themselves in poor health. Men and women experience many of the same problems. Some common ones are depression and substance use disorders. Guilt about the incident and fear of reporting it are also common among men and women because they are feeling that they won't be believed. However, men are afraid they will be questioned about their sexuality, and women are afraid they will be persecuted and their reputation will be tarnished. Research has determined that family experiences and social interaction can contribute to developed attitudes that influence coercive behavior. Examples of those are early childhood adversity, family violence, child abuse, peer pressure, hostility towards women, and the perceived notion that forced sex is okay. Research has shown that the majority of males who sexually coerce do so more than once during their college careers. Repeat offenders often experience more socioeconomic stressors and patterns of severe early offending, and that the level of sexual arousal can impact the perpetrator's perception of the benefits and consequences of engaging in sexual coercion. Research shows that women who physically fight back, scream, or run away during a coercive event are more likely to prevent it from escalating than those who try to reason, freeze, or cry. However, only 20 to 25% of victims use those assertive resistance strategies, partially due to the perception that the assertive resistance can result in greater bodily harm. However, the research does not support that conclusion. This is the end of my presentation. Thank you.